Welcome everyone, and thank you once again for joining one of our ADI webinars. This one is a bit different. This is the delayed launch of our Plan to Impact report in its third edition. Usually, we do this launch when the World Health Assembly is held by the World Health Organization in Geneva. At the time, we have the benefit of having many people from various ministries of health around the world and our members in the room with us. This is the first time this event is being run virtually. And I'm pleased to report that we have had a huge amount of subscription for this event, which has given me heart that there is interest in policy for dementia. The reality is that without policy for dementia, there's not going to be much change globally. We are a movement and we need to stay together, and we need to make sure that we help the World Health Organization and the governments that have made a commitment towards creating national plans to make that happen. And this is the spirit of this report. We look with our members at what is actually happening in countries, and if what is actually happening is making an impact, a difference for people on the ground. Now, let me tell you what is going to happen today. We are going to have a panel presentation. I'm going to talk briefly about the report. Then Kate Swaffer is going to speak about the vision and the issues that people with dementia have during this particular period of time that we're talking about. We're talking about the last year. We're monitoring what happened in dementia globally. Then Dr. Deborah Kestel, who is the Director of Mental Health and Substance Abuse at the WHO, is going to give us a brief précis of what is happening at WHO, followed by Dr. Nasri Omar. We are delighted and honored for the first time in our side events ever to have a representative from an African country to speak. Then we're going to have Dr. Hanadi Hamis, who may be substituted by another official from the Qatari ministry. Then we're going to have Dr. Kanako Kitahara, who is from the government of Japan, the first government who is a leading light in dementia globally. Then we'll have Dr. Ji-won So, who is going to talk to us about South Korea. Many of you know how enthusiastic I was when I went to see what South Korea is doing about their dementia plan. They certainly are leading the way globally. And then we will have Dr. Guðlaug Einarsdóttir from Iceland. Iceland is the last country that has announced a dementia plan, so we're delighted to have her with us. To end, we will have Fumie Grigo, who is the Deputy Director General of the International Federation of Pharmaceutical Manufacturers and Association, IFPMA, who is also a co-sponsor of the event. So thank you very much, IFPMA, for allowing us to run this event. And she will tell us about the industry perspective on what is happening on the plans. We will try and have time for a question and answer. At this stage, I want to ask all of you that are part of Ministry of Health that may be on the line. I already know that there are representatives of Trinidad and Tobago and Ireland, but in any case, please make yourself known by using the chat. So tell us now who you are, so that then I can call for your floor intervention later. In any case, if you don't want to speak, just let us know, but otherwise it would be lovely to hear from you briefly at the end. For every other participant, if you have questions, please use the chat function as well. We will not allow people to raise their hands. The chat function is how we will be communicating. Now, my team reminds me that I have to introduce myself. I am Paola Barberino. I'm the Chief Executive Officer of Alzheimer's Disease International. I always forget to introduce myself. So can I now have the list of our panelists? So I have already gone through the list. There they are. And the next slide, please. Thank you very much. So it's a great pleasure to launch our third edition of Plan to Impact. I must thank, first and foremost, my co-authors, who are Annie Bliss, Chris Lynch, and Laura Dabas, who are all on the line, although you won't see them. It's been a huge amount of work to get this report together, and we have a huge list of contributors who also I need to thank immensely for contributing so poignantly to the report. The report reports on the progress towards the Global Action Plan of the WHO, and we know that a lot of governments are still behind schedule. Is looking at the challenges and opportunity of COVID-19 for global dementia policy. The reality is that we have seen a lot happening in the last 6 months. There's been definitely a trampling and an abusing of the human rights of senior citizens globally. And I think this cannot be denied. And I think that we will need to sharpen our policy and advocacy focus in the next year to make sure that this is remembered and it does never happen again. But we are also concerned because a lot of people are not looking for diagnosis of dementia at the moment because they're too worried about attending surgeries, and therefore there is a reduced capacity to have post-diagnostic support for the families. In general, any kind of social services and care seems to be interrupted in the vast majority of the world, and this is a problem and a concern because what is going to be the consequences of that? And there are also consequences for the interruption of research and of clinical trials during this period. I think you all know by now what happened in residential care facilities. Once again, this is something that has been looked at as aghast. We thank some of the governments, and I'm thinking of the UK and Italy, who have actually for the first time published figures of how many people with dementia have in fact been victim during the COVID pandemic. The latest figures from the UK government is 26% of people who have died with COVID have dementia, and from Italy, 20%. I can also invite you, please, if you do have the figures from your country, send them to us. Many countries are slowly asking their National Statistics Office to provide these figures, and we are trying to collate them together to understand the impact, once again, of this new event on our constituency. The report also has expert essays, it has case studies, and it calls for government to heed lessons from COVID-19, but in general, it calls on government to do the decent thing, the thing that we should be doing, and create national action plans, strategies, whatever we want to call them, but most importantly, they have to be funded, because we can call a plan, but unless there is some money ring fence for a plan, nothing is going to happen. Next slide, please. Thank you, Annie. So here you can see a substantial part of the report, which we hope you will read, and you will try and find your nation. In deep red are the nations that do have a plan, in orange the one that are thinking of developing a plan, and in light orange those that haven't got a plan at all. You can see how some vast swathes of the world are unfortunately still without red. We want that map to be read. Every panelist on this panel wants that map to be read, and that's why they're on the panel. They're all working incredibly hard to make that happen. Next slide, please. And why do we want to make it happen? Because every 3 seconds, someone in the world develops dementia. It's a $2 trillion disease very quickly. It was a $1 trillion disease in 2015. And by 2050, we estimate there's going to be 152 people with dementia globally. Right now, there are well over 50 million, although, as we know, many of them will have fallen victim of COVID-19, sad as it is to say this. Now, this slide tells you what has happened in the last year, and as you can see, not much has happened. So the red column tells you how much needs to happen for 2025 for the targets of the World Health Organization to be met. So in 2020, very few countries have announced a policy for dementia. This is not good enough. We need to do so much more. And there is this fear that COVID-19 may represent an excuse for governments not to do that. And there is this important message I really want to convey to you. We must make sure that that does not happen, because this is also a massive emergency, and we must make sure that dementia plans still take place. Now, next slide, please. This is an extract of the report. As you can see, there's going to be a lot of more information. It's presented in an easy to digest way. I hope you can have a look at your country and then draw some conclusions from that. Next slide, please. And now I'd like to pass the floor to Kate Swaffa, who is the Chair, CEO and co-founder of Dementia Alliance International and the board member of ADI. Please, Kate.
Thank you for your introduction, Paula, and for the invitation to join the panel at this important side event today. Good morning, good afternoon, good evening, depending on where you are, and welcome to everyone. It's my great pleasure to be here with you, and I too thank you all for joining us at this important side event to the 73rd World Health Assembly and to launch this important ADI report. My congratulations also and thanks to Paula and her formidable team for their continued excellent work, not only in producing this report, but for all that they do, especially during such trying times. Thank you, Paula and the team. It's a credit to you all. On reading this ADI report, which has been brief because it's only just come out, it's clear that the pandemic has changed the world. And at least for now, we must all work together to ensure dementia is not forgotten. It is a rich report which provides data, an update of national dementia plans, including country progress towards the 7 action areas of the WHO Global Dementia Action Plan, and many other updates. Since this pandemic, as Paula mentioned, diagnosis rates are much lower due to isolation and also due to, in some countries, many of the memory clinics being closed, which obviously has a negative effect on research in the field. So it's not only basic supplies that people have been struggling to buy, but also people with dementia have struggled to get adequate health and social care. I was quoted in the report saying that in 2020, the rest of the world suddenly experienced what people with dementia and our families experience on a daily basis after diagnosis. Things such as isolation, fear and anxiety, physical and social distancing from many, including often family and friends. Sadly, this is true, and we also experience systemic discrimination and stigma almost immediately upon diagnosis. Families and care partners also face additional isolation and a reduction in services and support, leaving many of them with no chance of having any time out from their unpaid, more than full-time roles. But is there an upside to coronavirus? Perhaps the first one that I could see is that many service providers and advocacy organisations who once only provided face-to-face support are now also providing online Zoom support. So that's providing opportunities for all of us, including people in remote and regional communities who were never able to get to face-to-face meetings. So I hope that that will continue on beyond the pandemic. Another positive or upside to the pandemic, if you can call it that, Ms. Catherine Hall, the Chief Executive of Alzheimer's New Zealand, alluded to another positive. She was quoted in an article saying that COVID-19 has made us aware of society's most vulnerable. Let's make being kind to them, them meaning people with dementia, more than a blip on the radar. If the COVID crisis has any upside, it's the fact that for the first time in decades, the plight of older people is receiving long overdue attention. And she went on to say the virus has not caused this problem. It has merely brought into sharp focus just how neglected with people and their families are. In a meeting yesterday, I was told that many people with dementia and their families in the UK and Ireland have said they'll be fearful of going outside when restrictions are lifted. And it is clear that that's the case for many people all over the globe who have increased and may increase isolation for much longer than others. The other fear that many people with dementia have expressed around the world is the potential increased isolation may mean their symptoms of dementia, they'll deteriorate more quickly, and their disabilities, their ability to remember, their day-to-day functioning and communication may be more negatively affected. And some report this has already happened. Sadly, we've also witnessed ageism and discrimination towards people with dementia. There continues to be a lack of transparency regarding the withholding of medical treatment from older persons and people with dementia and other disabilities in some countries, and a lack of transparency of data regarding deaths in residential care, for example, a lack of PPE and testing of healthcare professionals, especially those working in nursing homes, and many additional breaches of human rights beyond what we already experience. So I guess in reality, never before have people without dementia experienced so acutely what people with dementia face, often from the time of diagnosis and on a diagnosis. Before the COVID-19 pandemic, most of the world looked the other way when faced with the reality that even the most basic of our human rights were being denied, including at the time of diagnosis and often for the rest of our life thereafter. So what this pandemic has done is to highlight more than ever before just how much harm has been done or is being done and how many civil liberties are being denied to us. Disability rights activist Sophie Morgan wrote of her experience. She, since I was paralysed in a car crash, I've spent days, weeks and even years trapped at home for health reasons. And I'm not the only one. For thousands of people with physical or mental disabilities as long-term health conditions, this is part of our lived experience. So this is the same for the millions of people with dementia too. The WHO, and as recently reported by the UN Special Rapporteur on the Rights of People with Disabilities, dementia is a major cause of disability and dependence among older persons globally, and a cause of disability for anyone of any age who is diagnosed with it. As you all know, dementia does not discriminate by age or by race or culture, career or socioeconomic status. However, people with dementia are still being discriminated against and experiencing isolation, discrimination and stigma. And I hope that now the virus has highlighted to others what this is actually like from the inside out, it will finally change for us all. After all, we all need a world that is free from loneliness, isolation, stigma and discrimination. As we all face the current crisis, I acknowledge the challenging nature of these times and hope that you, your colleagues and your families all stay safe and well. And once again, thank you for all you do at ADI, Paula and your team, and congratulations to the other speakers. I apologise that I can't stay on. I have to actually present at another webinar very shortly. So all the best for the rest of the side event. Thanks, Paula.
Thank you so much, Kate. I cannot thank you enough for what you have just said. It's so important, and it's so important for it coming from you. When I was reading the report, what really jumped to my eyes was your wonderful quote, which you just mentioned, and I'd like to underline it again. During COVID-19, many people in the world have finally experienced what people living with dementia experience every day. Isolation, a sense of powerlessness, and incapacity to communicate with the world and for the world to understand what they're going through. It's an awful way to come to learn what a lot of people have experienced. Alas, can we please use this as an important point to our advocacy going forward? More people will understand what our constituency is going through. And now it is my enormous pleasure to introduce you to Dr. Deborah Kespel, whose team at the World Health Organization has been amazing throughout all of these, continuing to work very, very hard to make sure that dementia is not forgotten. It's one of their priorities. Deborah, you've got to unmute yourself, and then the floor is yours.
Muting myself, and the floor is mine. Thank you, Paula and ADI. Thank you very much for this opportunity. As you know, 2020 marks 5 years since the first ministerial conference on dementia, and the conference raised awareness of dementia globally and ultimately led to the development of the Global Action Plan on the Public Health Response to Dementia 2017-2020. And 3 years into the implementation of the Global Dementia Action Plan, we can affirm that significant progress has been made, though much remains to be accomplished both at global and at national level. And so I thank ADI for their ongoing partnership, and I congratulate Paula for the team and for compiling yet another great edition of From Plan to Impact, particularly in these difficult times. Now let me share with you some of WHO's activities over the last year. We have worked with governments and other partners to develop and implement national dementia plans, whether they are standalone or integrated into other existing policies, through national and regional workshops, and by providing targeted technical support when specifically needed or requested. To assist countries in monitoring the global dementia situation, WHO developed the Global Dementia Observatory, GDO. I hope many of you are already familiar with that. A data and knowledge exchange platform that also acts as monitoring mechanism for the Global Dementia Action Plan, compiling data across all 7 actions areas of the plan. And there are currently 54 countries that are included in the GDO, and 39 more are in the process of collecting data. So we are getting there with a decent number soon. The GDO data has informed the development of dementia plans, was the case in Qatar recently. Dr. Nadi may speak about that, and WHO's regular update to member states for this year World Health Assembly. And the GDO also provides country profiles for most countries and are available online for anybody who wants to check. And based on available data from GDO, some areas appear to be further advanced than others. For example, the number of countries able to report on dementia diagnostic rates remains very low. And similarly, more countries need to develop and implement national dementia plans for us globally to be able to reach the targets that we have set up for 2025. However, the year 2020 also brought us COVID-19, and the challenging health and social care system has been affected by all over the world, and the disproportionate impact we witnessed globally on residents of long-term care homes, many of whom are with dementia, with respect to the increased vulnerability, severity, and mortality due to COVID-19 deeply concerns me and me personally and my organization, and highlights the importance of a balanced, human-centered approach, following a bit what Kate has just said, right? Together we need now to ensure that collectively we generate a system that will safeguard the individual rights of people with dementia, in particular in this case. So collecting detailed and disaggregated information on dementia as part of the Global Dementia Observatory is essential for planning and providing equitable and high quality services for people with dementia. So now during COVID-19 and in the years to come is equally valid. We will continue then to work closely with member states and other stakeholders in this area. And one concrete project that has been we have been working on within the context of COVID-19 is iSupport Lite. As you know, iSupport is a WHO's training program for caregivers of people with dementia. Caring for someone with dementia can feel overwhelming at times, and the lockdowns and discontinuation of home care services associated with the pandemic left many caregivers alone, fending for themselves and the person with dementia. So this highlighted the need to provide accessible tips and self-help messages for caregiver. And with iSupport Lite, we have extracted the key messages from the full iSupport training, and we are making them available as easy read posters and questions and answers on WHO website, and very soon, hopefully also on social media. I was supposed to have one behind me, but technology not always help us. So you will have to go and look for them in the website. So the COVID-19 pandemic has also been a timely reminder that we need to invest more in digital solutions and technology for dementia. Maybe we can discuss more about that later on. And we are exploring the potential of digital technologies for dementia, including in the areas of dementia risk reduction and the caregiver support that I just mentioned. So finally, COVID-19 has also unveiled the importance of communities standing together, protecting the most vulnerable and helping each other in times of physical distancing. In many ways, COVID-19 has put a spotlight on the needs and rights of older people, and particularly those living with dementia. Our ongoing activities to increase dementia awareness, inclusion, and friendliness are very much aligned with this sentiment. So I thank you very much.
Thank you so much, Deborah. I mean, your team has been amazing during this time for so many very reasons. And thank you also for helping us to collect data on dementia, because that is one thing that WHO can do. I was speaking with one of our members yesterday who rightly was saying, well, you know, our ministry is not collecting data on dementia because nobody's asking them to. And it is really the WHO that can have that power of reminding people, are you actually doing this? Because people may have the data or may want to collect the data, but just that they are not thinking. And for our constituency, that is going to be a super precious piece of work. Thanks also for mentioning technology. Indeed, during this time, we've seen a lot of positive things. You will see it in the introduction of the report. We've seen telemedicine really making a leap forward. We have seen a lot of technology being used so positively to create a sense of community and support. We've talked more about our public webinars of these issues, and we'll talk about it in the future too. So thank you for being with us. Now I'm going to pass the floor to Dr. Nasri Omar. Please unmute yourself. This is an historical moment for ADI. It is the first time that an African nation representative is coming to speak about their intention of holding a dementia plan, of making a dementia plan happen. I cannot tell you how proud we are to have you with us. Please, Dr. Omar, the floor is yours.
Thank you, Paula, and thank you, ADI, for inviting me and the ministry for this event. I am Dr. Nasri Omar, and today I'm going to be very brief about what we have done so far to develop a national dementia action plan in Kenya. So I don't know if you can see the slides. So the outline is just where we started and how we are prioritizing dementia in the context of COVID-19. And what is our roadmap, and just a brief summary. So the aspects which are not in the slide, which I'll just add, our work on dementia started on 2017, where we had the 4th African Conference on Dementia, and it was hosted for the first time in Kenya. And from this conference, the Ministry of Health attended this conference, and from there, on 21st September 2017, we commemorated the World Alzheimer's Day. And this has been happening every year since then. And also there was commitment which was made by the Director of Mental Health, Dr. Simon Juguna, to develop a national dementia action plan. So we started the journey very early in 2018 to 2020. The Ministry of Health has been involved in the Mind Walks, which are being organized by Alzheimer's Disease Organization of Kenya. And in May 2018, we started collaboration with the STRIDE team. STRIDE is the Strengthening Response to Dementia in Developing Countries. And in June of the same year, we did the first Theory of Change workshop with the STRIDE team. And there we were able to meet the many stakeholders involved in dementia care in Kenya. And from 2018 to 2020, we've actually been looking for funds and sourcing for funds from the STRIDE partners and our other partners, including the World Health Organization Kenya office. So next slide. So the conception of the plan towards the Dementia Action Plan in 2018 also to date, we've been generating local evidence which is going to inform the National Dementia Action Plan. And this has been done by the STRIDE Kenya team. On 5th March of this year, the Ministry of Health made a formal request to partners for support to develop the National Dementia Action Plan. And I think like a week later, we had our first COVID case. So everything was put on hold at that time because the priority shifted to COVID-19, not just for the Ministry of Health, but also for the local partners that we have. So all COVID-related projects were put on hold. Next slide. Then now, how do we prioritize dementia in the context of COVID-19? In May of this year, the Director of Mental Health informed us to begin working on projects we had put on hold. And the Dementia Action Plan was one of those priority projects that we were told to revive again and work on it. And on 1st of June, we included slides of dementia in psychological first aid training, which we are currently doing across the country as part of our national response to COVID-19. And through the psychological first aid trainings, we've been able to reach healthcare workers, police officers, prison officers, palliative care specialists, community health volunteers, and other service providers. In June of this year, the STRIDE Kenya team presented to us their first draft of the situational analysis they've done. which covered the overall health system, the long-term care and dementia care in Kenya. And this is very important for us when we're going to develop our National Dementia Action Plan to make it more relevant. And on 18th of June this year, we submitted a concept note and an updated budget, keeping in mind the COVID-19 government directives, because we can't have face-to-face meetings of more than 15 people. Everyone has to wear a mask and we have to keep the 2-meter distance. So we had to update our budget and concept note on that regard. And this has already been shared with the partners, including the World Health Organization. And in June this year also, we have put down plans and for Kenya to start contributing to the Global Dementia Observatory. Next slide. So the plan to impact roadmap is we are setting up a technical working group this month. And this is going to be spearhead the development and implementation of the National Dementia Action Plan. It will have representation from service user organizations and families and carers. And this will also include the National Advisory Group on Dementia on Stride in Kenya. And the same this month as well, we have included the National Dementia Action Plan and other dementia-related activities as part of an annual work plan for the Division of Mental Health, meaning we have to deliver it by next year, latest June 2021. So below is the timelines on when we want to complete our plan for Kenya. So we are planning for the next stakeholders meeting, and this our first stakeholders meeting, and this we are planning latest to be on the 2nd week of July. And from here, we'll have our draft 0 of the action plan. And from July to November, we'll have several other meetings to looking at the different drafts of the action plan. And we'll have a validation meeting with the different stakeholders. The output here will be the final draft of our action plan. And from November to December, between November and December, we plan to launch the National Dementia Action Plan. And the whole of next year, we are planning to disseminate the action plan across the 47 counties in Kenya, because in Kenya, health is devolved, so implementation of the plan is the responsibility of the county governments. And all these timelines are dependent on our availability of funds. So maybe something else which I did not include is we have ongoing work other than what we have said, and we have public awareness campaigns which we are running, and we're also starting caregiver training and support groups, making our clinics more user-friendly. We are also starting social care services for older persons, counseling and psychosocial support. We are also partnering with other organizations to enable access to essential medication for people with dementia, and having some form of gadgets or GPS trackers to help once they go missing, or to be able to track them and be able to bring them back home. And then we are also working with the Quality Rights Initiative with the WHO on dementia. And maybe acknowledgements, I'd like to acknowledge the Ministry of Health, WHO, Stride Kenya team, National Advisory Group on Stride Kenya, and Stride collaborators, including ADI and LSE. Thank you.
Thank you very much, Dr. Omar. I think this has been a joy to listen to, and also the amount and wealth of activities that you already have in place. I mean, I really, really hope. Thank you also for pointing out the funding issue. You know, funding is key. You can have the best will in the world, but still, Kenya is a big country. It's very decentralized. It will need funding. So we can try and all work together towards that too. Now, thank you very much. I need to move this forward because we have a lot of speakers. Can I remind the speakers, please, to keep to 5 minutes maximum and try and avoid me having to cut you. I hate cutting people off. We were supposed to have Dr. Hanadi Hamis Mubarak Al-Hamad with us from the Ministry of Health in Qatar. However, we, I think, have Dr. Mani Chandran, who is Dr. Hanadi, very wonderful right hand, and we know him very well. So Dr. Mani, thank you for being with us today. Can I give you the floor? Qatar has been doing so much, and we are so proud.
Thank you, Paula. You know, it's always a pleasure to come to the ADI family. From Qatar, we wish you all safe and well all times. I'm here on behalf of Dr. Hanadi, who is our national lead for healthy aging. Can we have the next slide? Here we have just tried to portray how we are doing, because our dementia plan, which was launched in November of 2018, is completely aligned as per the framework of Global Dementia Observatory. So we have just put as to how we are doing compared in an overall picture, as you can see, we are progressing, inshallah, reasonably well. There are few areas where we have to catch further on. Can I have the next slide? So looking at each specific areas of the 7 action areas, when we look at dementia as a public health priority, obviously we have, as I mentioned, we have launched the plan. The dementia legislation per se, the draft elderly law is ready. It is in the final stages of going through the ministry. The driving regulations also, we are in the process. The COVID has impacted our tracking on it. But I'm very pleased to inform, even amidst the COVID, we have been able to launch the National Dementia Guideline and Practice Recommendation. Dementia Care Coordinator work is underway. Next slide, please. Looking at the heart of the dementia plan, which is the dementia diagnosis, treatment, care, and support. We are working through each of the important areas here, as you can see in the slide. But the point that I would like to highlight is that with support of ADI and Regional Director D.Y. Suharia, we have been blessed to launch and get training done for national, and we have established a national dementia trainers program. We have identified 11 national dementia trainers who are in the process to go on to train all the health and social care staff across the Hamad Medical Corporation healthcare facilities, as well as the community private agencies, private agency nurses. Because here in Qatar, predominantly the patients are looked after in their own home by the private nurses. So our ADI has supported us to get this training program done, and which is blessed by the Hamad International Training Center. So that's the highlight I would like to show here. And of course, our memory clinic is progressed. We have gone into the primary care with 3 zones of Qatar having a primary care memory clinic, which is supported by specialists from us. And most important, which is the Qatar Alzheimer's Association, from a carer support perspective. This is, I'm pleased to inform the legal part is done. It was actually February when we had the legal process completed. Unfortunately, the COVID has put a stalemate here because of the ministry had to pass through the final paperwork to get us the registration. But our carers are working on it, and we are hoping before this World Alzheimer's Month, inshallah, we will be there. Next slide, please. Here from the when we're looking at the dementia carers, most important thing that we have done during this time, which I'm very proud to say, is that amidst this COVID pandemic, we have been able to launch the National Alzheimer's and Memory Services Helpline, termed as Raha, which in Arabic means comfort. This helpline is up and running, and it is supported by the National Dementia Trainers. And of course, our awareness campaign goes through year on year with the major campaign that we coincide with the World Alzheimer's Month. Can I have the next slide? This is an area where we have to further progress in terms of the dementia research and innovation. This hopefully in the coming months we will capture more. Next slide, please. Now, this is where I wanted to focus today particularly. The COVID pandemic, yes, on one aspect, it has taken away a lot of things from us. But at the same time, it has blessed us with quite a few very important things. Because our carers here always felt when they go to the general hospital, it is a pool of everybody there. And they always wished if we can have a place which is like a geriatric hospital, where it's catering primarily for the elderly. And here we have been able to establish an urgent daycare unit, which is purely for our elders. We have an acute geriatric assessment unit, again in our elderly specified hospital zone. And during this time, we have also launched, because rightly Kate and other speakers alluded to, that the memory clinic and the assessments, and if any the clinic assessments are coming down during this pandemic time. But what Qatar government, we are blessed, we are grateful to them. With the support of Ministry of Public Health, we have a software called BC, and through that, we have been able to establish virtual clinics. So if any, here in Qatar, when we compared our memory clinic data last year, this time, our numbers are actually higher this time. So more patients we are able to see compared to last year this time because of the facility of technology.
Dr. Mani, unfortunately, I'll have to cut you in a second.
Okay, we're going to the next slide, please. So the challenges that rightly we are facing, even though we have been able to achieve few things, is funding priority has changed. The ministry focus is obviously at the COVID at this point in time, but we are hopeful that we will continue with our strides, and with the great support of our leader, Dr. Hanadi, we are hopeful that we will get through this. Thank you.
Thank you so much, Dr. Mani, also for coming in at short notice. It's always wonderful to hear the wealth of things that Qatar is doing so quickly, and the great example that you're doing to all the Arab-speaking world. So thank you so much. And can I now call on my next panelist to unmute herself? That's Dr. Kanako Kitahara, who is a doctor and is the director of the Office of Long-Term Care Insurance Data Analysis in the Division of the Health for the Elderly, Health and Welfare Bureau for the Elderly in the Ministry of Health, Labor and Welfare of Japan. I mean, Japan has been incredible from the beginning. It's a world leader. Dr. Kanaka, it's a pleasure to have you with us. You have the floor.
Thank you very much for the introduction. And do you hear me well?
Yes.
Thank you. And also congratulations on the publication of the report. So I'm Kanako Kitahara from Japan, and today I'd like to introduce the dementia policies in Japan. Could you move to the next slide? Thank you. And could you move to the next slide? Thank you. And Japan is a country located in Asia, and the size of Japan is a little smaller than the state of California in the US. And our population is approximately 126 million, and of the population, 28% is age 65 and over. And our life expectancy in 2019 is 81 years old for male and 87 years for female. However, the life expectancy in 1950, it was approximately 60 years old. So it is recently for us to, people can live longer. So that is why the policies for related to long-term care and dementia is really important to us. So could you move to the next slide? Thank you. And I'd like to introduce about the development national policies on dementia. So in 2012, the Ministry of Health launched the first plan that is called Orange Plan. And we revised it in 2015. It is called New Orange Plan, and that was launched by 12 related ministries and agencies. And just last year, the National Framework for Promotion of Dementia Policies adopted at the Ministerial Council as cabinet decision. And that is comprised of 5 pillars, and I'd like to introduce them. Could you move to the next slide? Thank you. And the first one is raising awareness and supporting persons with dementia. And Ministry of Health raised the website for raising awareness. And also we have the event, especially in the months of World Alzheimer Month. And also we have a dementia supporter program, and anybody can become a supporter after they receive the lecture. And also they will receive the orange band, also I have it. And the number of supporters is now over 12 million. And also we launched a public-private council on dementia. And at present, more than 100 private sector joined it. The second pillar of the national framework is risk reduction. And especially we promote the saloons activity that is organized by residents. And the number of such salons and retail participants is increasing. And these pictures are, for example, of the activities of the salon. The first one is exercise at the showroom of Toyota, because we have Toyota company. And the Toyota showroom is available for such a salon activity. So everybody can gather to the showroom and they enjoy exercise. And maybe you can find that almost all participants are female. And so that is why Setagayaku of Tokyo especially focusing on male activity. So that is called Dundee Exercise Club. And the next slide, please. And the third pillar is medical and long-term care and support for caregivers. And we promote Dementia Cafe, and that is a place for sharing information with people with dementia and their family. And the number of cafe is now more than 7,000. And also administrative office provides the consultation for caregivers. Moreover, we have intensive support team and which has a function of coordination between the person who is suspected to be with the dementia to the long-term care or medical care. The fourth pillar is promotion of dementia barrier-free support for people with early onset dementia and support for social partnership. For that purpose, we promote Team Orange project. That team is comprised of dementia supporter, and they promote barrier-free society.
Dr. Kanako, just to let you know that we'll have to cut you short slowly, so you may want to get to the conclusions.
Oh, sorry. Okay. And also the research. And the next slide is our response to the COVID-19. So our epidemic is peaked over, and Japanese government secured a supplementary funding, and we provided the PPEs and training videos to the caregivers. And also we launched the e-learning system and e-salon system. So this is a very challenging time, and we made every effort to conquer these problems. And could you move over to the next slide? So this is the last slide of my presentation. I also would like to mention about the 2019 Health Ministers Declaration. So it was the first time to have the aging as an agenda. So, and also we included the health security issue here. So this is challenging time, but we need every effort. I'm sorry to be late. So the next slide is for your reference of our national framework. So thank you very much for your attention.
Thank you very much, Dr. Kanako. The fact is that Japan is doing so much. I'm not surprised you've gone a little bit over time. I particularly thank you for raising the issue of dementia-friendly community. Japan invented them. There's been already a few questions in the chat. Really, Japan, we have so much to learn from you. For mentioning Okayama, ADI had a part in the G20 declaration, and we are so grateful that Japan led the way. And especially to tell us about Japan's response to COVID-19, which is something that we will study with more attention to incorporate in our response. Now, very briefly, I'd like to introduce you to Dr. Ji-won So from the National Institute of Dementia, KNID, the Department of Neurology of the National Medical Center of the Republic of Korea. I cannot tell you how impressed I have been from the first time I read the dementia plan of South Korea. It's incredible what you have been doing in such a short period of time. So Dr. Soho, please, the floor is yours. And please do unmute yourself and stick to the time, 5 minutes. Thank you.
Thank you, Paula, and thank you, ADI, for inviting me to this special webinar. I will introduce how Korean National Dementia Care Plan has changed and is being implemented during this COVID pandemic. Next slide, please. After the declaration of the National Dementia Initiative in 2017, along with the third National Dementia Plan established in 2016, we established local dementia care centers throughout the nation. And now we have 256 local dementia care centers in Korea, providing individualized service from screening tests for dementia to community care for people with dementia and their family. It includes numerous group programs such as dementia shelter for patients and dementia cafe for patients and their family, and cognitive training programs for elderly with normal cognition or mild cognitive impairment to prevent dementia. Next slide, please. In January, the first confirmed case of COVID-19 was reported in Korea, and this graph shows daily trend of confirmed positive cases. As the country saw the highest daily spike in COVID-19 cases in late February, the government announced the social distancing measures that, among others, included closing local dementia care centers. The closure of centers was initially announced for 2 weeks by the Ministry of Health and Welfare, but was soon extended as the situation continued. During this period of closure, complaints and feedback from patients, families, and dementia caregivers were received that emphasized the need for continued service despite the pandemic. In response, several dementia care centers began providing remote service that gradually expanded to other centers. Early May, when it was deemed that the coronavirus outbreak was largely under control, the government announced a new routine distancing in daily life, otherwise relaxed social distancing, from May 6th, allowing gathering of a small number of people on assumption that individuals follow hygiene and disinfection guidelines. Accordingly, the Ministry of Health and Welfare also published official instructions for operations of dementia centers in this new routine, relaxed social distancing condition. Next slide, please. The new ministry instructions categorize the services of dementia center by 3 stages. Stage 1 includes case management and supply of goods like cane or diapers and double diagnostic systems. It can be provided in a routine practice.
Dr. G1, you may be careful with your papers because there's a lot of background noises that is coming, so the audio is getting worse.
And on stage 2, home visits could be carried out to providing counseling, dementia screening, and diagnostic tests with strict personal hygiene management. This is conducted only in the form of one-on-one contact. Stage 3, group programs such as dementia shelter or cognitive trainings can only be provided in remote services without making direct personal contact. Next slide, please. And these pictures show examples of current activities of dementia center in COVID-19 pandemic. The upper left shows a home visit, and just to the right is cognitive exercise program designed for home training. For patients that do not want home visit out of fear of catching COVID-19, cognitive training materials can also be delivered to their homes to avoid personal contact while still providing the services. The lower left is a group exercise via Zoom, and the lower middle shows digital cognitive training program that can be played on tablet PC, and the right is another form of online interactive at-home service with the teacher and the remote dementia center. As the pandemic seems to last longer than we had hoped, we are actively trying to extend such remote services of dementia centers to reduce the burden of dementia care. Thank you.
Thank you so much, Dr. Soho. This has been extremely interesting for us to hear. And of course, we would have loved to have South Korea speaking at our Singapore conference in March. It did not happen, was postponed to December. We will hope to hear more from KNID, an institution that we all should take example from, especially in the dealing of data. You guys are incredible. So now it's with great pleasure that I introduce you to my final national panelist and Ministry of Health panelist, and that's Dr. Gudlögt Einarsdottir from Iceland. Iceland is the latest country to have published a dementia plan. We are delighted that they have. It's a great example. We hope more in Europe will follow soon. Dr. Enardos, the floor is yours.
Thank you. And thank you, IDI, for inviting me to this event. I'm going to tell you a little bit about our new national dementia plan in Iceland and how a very small country did its first national dementia plan. Next slide, please. First, a little bit about Iceland. The inhabitants are only 340,000, very few. We have our own language, Icelandic, so everything must be translated because although most Icelanders speak English, to some point, they don't read it. Ministry of Health, we are only 50 people. Our administration is very few and each person in the ministry has a big workload. Dementia is linked to the elderly, but that's beginning to change. For a small country, international collaboration is very important. And we have a good cooperation with the Nordic countries and through Alzheimer's Europe. We have a strong infrastructure of health and social services. And according to Alzheimer's Europe numbers, it is estimated that about 4,000 to 5,000 people in Iceland have dementia and 250 people under the age of 65. Next slide, please. Our biggest, and because we have a lot to build on with our strong infrastructure, our biggest challenge is in making our first dementia strategy was similar to other countries. That is a limited support to at the beginning of the disease and its random content of the service. Other big challenge is to integrate the service we provide to older persons because we have a shared responsibility between the state and the municipalities. The state has the health service and the municipalities has the social service. Next slide, please. So the task was therefore to connect the infrastructure and build bridges from our current situation to our future vision. Next. The process of making of the Icelandic strategy was a parliamentary resolution adopted to draw up a strategy on the service to a person with dementia was done in the spring 2017, please. The Minister of Health assigned one of the Icelandic most respected geriatricians, Jón Snædal, to write a report on our current situation in the service to people with dementia and suggest actions and future vision that we did in 2019. We then use an official governmental web consultation portal where everyone can submit criticism, comments, and suggestions to the report. And we received comments from the main stakeholders in the autumn of last autumn. We then made the implementation schedule based on the proposals in the report and the comments received, and that we did last winter. The strategy was then released in April 2020. Next slide, please. The content of our action plan is similar to others, for example, the Norwegian one. As you see here, each of the main targets areas is broken down into modules with measurable goals. It should therefore be easy for the Ministry of Health to monitor the implementation of the strategy and assess its results. But of course, we are only just starting doing this. Next slide, yeah. The focus on dementia is rising in Iceland, both early onset and late onset dementia. Alzheimer Iceland is a respected and trusted organization and has done a great job raising the awareness of dementia in Iceland. The new action plan has also received a lot of attention, and now our job is to implement it. Some municipalities are beginning to cooperate with Alzheimer Iceland to be certified as friendly communities. One of the latest focus on dementia was on our National Day, June the 17th, when the President of Iceland invested the former deputy mayor of Reykjavik, Elly Katrín Guðmundsdóttir, with the Order of the Falcon for her contribution to open discussion about Alzheimer's disease. But Ms. Guðmundsdóttir was diagnosed with Alzheimer by the age of 51 and has been a pioneer to other young people with Alzheimer. Next slide, please. And then...
Can I ask you to speed up? Because we are...
Speed up, yeah. This is my last slide. It's about COVID, and you can read all about COVID in Iceland in covid.is. We didn't have to prioritize the service to sick people because we managed to slow down the progress, and now we have all services open and our borders too. And the gatherings are limited to 200 people. And I want to point out that during the pandemic, we kept all the daycare centers for people with dementia open to keep their daily routine so they wouldn't get sicker at the time, and it would be a bigger problem. But that's for now. Thank you.
Thank you so much, Dr. Einarsdóttir. Very interesting, especially your last slide, which really does give us a lot of information on that. I wonder whether you know right now in Iceland how many of those people who unfortunately didn't make it may have had dementia or people got infected. We'll take those questions later though.
Yeah.
A lot of questions. And I need to give the floor to Fumie Grigo. Fumie, if you would like to unmute yourself, who is the Deputy Director General and Chief Operating Officer of the IFPMA, and who will tell us about what is industry doing during COVID-19. Fumie, if I can ask you to be 5 minutes long and no more, because we would really like to take some of the fantastic questions that are coming in. Thanks.
Absolutely, and I'll try to be even less than 5 minutes, but thank you so much, and really congratulations to the great work and the report, and also very inspired by all the great work that's being done by WHO and all of the countries on caring for dementia patients and really supporting their caregivers. I think what really this crisis underscores for patients is absolutely the need for new solutions, and science is the way forward. And so we're really excited about some of the progress in research, and we can't predict, when FDA or EMA approval of new breakthrough therapies will come, but we do have some very promising candidates in the pipeline and in final stages of approval. And so we hope that we provide new hope for patients and caregivers, and also new tools for countries to really address this growing issue. I think one of the key concerns in the COVID-19 crisis is that clinical research, along with diagnosis and care, is at risk of being slowed down because it is very difficult to reach the over 65 age patients. And so our companies are doing their best in order to minimize that impact. But I think this is where we look to partner with all of the key stakeholders, particularly the regulators, to ensure the integrity of the clinical trials process so that we don't allow this COVID crisis to slow progress in science. Another topic that's top of mind for many of our companies is making sure that health systems are ready to absorb and uptake the new innovations and breakthroughs. And so there's a lot of great conversations happening all over the world on universal health coverage, but even within the more advanced health systems, for countries to be ready to have reimbursement systems in place to address out-of-pocket costs for patients. I think these are, of course, foremost topics in terms of forecasting and horizon scanning and health system readiness. As we see new breakthroughs potentially come through, we want to make sure that patients benefit from it. And so I think these are the key topics that, of course, are very much in sync with the broader COVID-19 discussions. But I think, as many speakers have already said, the high risk of dementia patients and the really underscores the importance of making progress on options for care for patients. So we're really excited to partner with all of the stakeholders here on finding that way forward and really trying to capitalize on the great science and research that we're seeing right now and do right by our patients.
For me, I cannot thank you enough for also the brevity of an intervention on an area that is so crucial, and is particularly crucial this year because we were so hoping to have perhaps the first few good news on pharmacological interventions, and indeed, let's cross fingers, we're all hoping that it will still arrive. I cannot tell you the sense of anticipation that everybody has. This is area 7 of the Global Action Plan, an area that definitely needs more support and an area that needs more investment from governments as well. Okay, now we have a few minutes. We have been inundated by questions. Our wonderful speakers have seen the chat line and many of them have already replied, as has the team from ADI. I want to pick up 2 questions. One I'll do very quickly and I'll do it myself. The second one, I will ask all panelists to give their view because I think it deserves that. The first question comes from Peter Whitehouse in the States. I think this is a question I can answer. And Peter is asking specifically, given that the COVID-19 has also highlighted bigger umbrella issues like climate change or like social inequality, what are we doing as international organizations and national organizations to incorporate those in our discourse? And Peter, this is the job of ADI. We do work with a lot of other non-governmental organizations in order to make sure that at least at global level, the advocacy is covered. And then we pass those learning to the members in country. But it is difficult, and it's difficult famously because some of the topics are very complex and very interlinked. And you will know as much as I know that at the moment that you helicopter up some of these issues, they often become very difficult to break down in simple, uncomplicated actions. And we also need to be careful not to water down our discourse around dementia, because in general, it is watered down automatically by the fact that governments do purport to have other priorities. So our focus is always trying to understand the wider and broader discourse and incorporate it in our policy and advocacy, but also remind governments at all times to focus on dementia. So I'll move on then to another question that has been raised by one of our wonderful members in Jamaica. And this question relates to the fact that telecare and telecounseling and telemedicine have been more popular during COVID-19. And this actually has some really positive outcomes. And she wanted to ask whether there were some practical tips that could be given, especially to family caregivers around this, and also whether there were any ethical implications. Now, Sandra, you asked the question. We have very few minutes left. So can I ask first and foremost, please, to our delegates from Japan to answer that question very briefly, please. And if you can't hear me, perhaps Deborah, can I ask you next to go on this question? So tips on telemedicine.
Yes, we introduced the telemedicine and telemeeting, and it had a positive impact because if there's no telemedicine or telemeeting system, maybe we had only restrictions over there. So that's why it worked a lot. But we are planning to evaluate the impact of COVID-19, especially regarding long-term care. But it is still launching, so we're waiting for the result. Thank you.
Lovely, thanks so much. Deborah, would you like to say something from WHO's perspective?
Well, thank you, Paula. I think just to complement is that we need to learn. I think that because it has been used a lot these days, I think that no answer alone will work. So maybe we need to continue developing this telemedicine, telecommunication with some other tools that could be, for example, providing tips, some kind of training for caregivers in the meantime, or somebody out there in the community. So how do we integrate different ways of providing support that can be complementary one to the other?
Thanks so much, Deborah. Can I ask, please, Jin Won from South Korea to say a few words about this? If you can unmute yourself.
Yeah. Actually, in Korea, there's some issues about tele-counseling and telemedicine because some people very reluctant to the technology, and older people cannot use the techniques. So in Korea, in our dementia center, the steps from dementia center just go to the patient's home and teach them the computers. And so I think we need other guidelines for education for their caregivers.
Brilliant, thank you very much. Can I now ask, please, if there is still Anthony von Gempas from Trinidad and Tobago's Ministry of Health on the line? Anthony, if you are on the line, can I ask you to unmute yourself and make a floor intervention around the intention of your government to do something around the Dementia Action Plan? Anthony, if you're on the line still, please can you unmute yourself? Maybe not. Then if we have the Ireland Ministry of Health representative, would you like to make a floor intervention? Please, Ireland Minister of Health, if you are here, please unmute yourself and make a floor intervention. Perhaps you can't. I'm told by my team that there is a technical issue. Then I will then ask, there is a question around the fact of whether we should create a campaign because of the fact that people are being left undiagnosed, and if this should be part of a public health campaign after COVID finishes. This is such an important question. We at ADI feel that there may be an issue here, that many people won't look for diagnosis. Gunnlög, could I ask you from Iceland point of view, whether you have any tips about what people could do around looking for diagnosis, given there's been such a big interval where people haven't?
Do you mean where the people get the diagnosis, or?
So there's going to be a lag because people were too scared during COVID to search for
Now
there's going to be a lot of people around the world that will not have searched for diagnosis, and a lot of the public health campaign has changed. From a government viewpoint, is there a point in making more public health campaign for people that may have not seek diagnosis of diseases to encourage them to seek diagnosis? I've seen the British government has been doing some work around this, but dementia has not come on the horizon yet.
Yes, a big part of our strategy is to raise awareness in the public to Alzheimer and to dementia. So to encourage people to seek help and encourage people to interact if they have any symptoms, or go to their GP to for help.
Thank you very much. That was a good point, but we probably will need some level of global dementia awareness campaign and then national awareness campaigns, because we do fear that there's going to be a real problem here about people already scared of seeking for diagnosis even more if there is no post-diagnosis.
Hi, good morning.
Support, which is a problem. Somebody's just come online. Is this by any chance Anthony?
Yes, it is.
Excellent.
Yes, it is. Okay. Our ministry has been given directive by our Minister of Health to actually start working on establishing a national dementia strategy for Trinidad and Tobago. We haven't had any formal policy or anything like that in times past. So we are currently in the process of gathering information, assessing what is there locally, because there are a few fragmented services, and we are looking to see where and how we can bring these together and put things in place to actually establish a structure for the delivery of dementia services in Trinidad and Tobago. Against that backdrop as well, we are pretty mindful that Trinidad and Tobago currently has an aging population based on our last national census information. So we are following the guidelines. There are things that we may be able to find and the information that was shared on the webinar today. And we are well on our way to start the process of developing our national dementia strategy. Thank you.
Anthony, thank you so much. It's a joy that you have been able to intervene, and even more of a joy to hear really about what is that you are doing in Trinidad and Tobago. We are very looking forward for another Caribbean country. We have so many Caribbean members to join in to try and doing a dementia action plan. Now, we have run out of time. I would like briefly to tell you that we had delegates from the following countries. If you were from another country and I don't mention you, please do work, type your name in the chat line so that we know that it was another country. So we had delegates from Qatar, Uganda, UK, Pakistan, Japan, South Africa, Thailand, Kitts and Nevis, Argentina, Burundi, Belgium, Austria, Australia, Jordan, Greece, US, Sri Lanka, Ireland, Jamaica, New Zealand, Trinidad and Tobago. I cannot thank enough all of you for having been part of that. I cannot thank enough my fellow panelists. I'm sorry that we have run out of time, but thank you so much for everything you've told us. I know that we rush through these webinars, but please bear in mind that there will be a recording that will circulate soon. You will be able to see our presentation at a much more sedate speed and really absorb the richness of the slides that were presented to us today. And hopefully read the report more in depth. There is a huge amount of information that has been poured into it. I thank everybody that has been with me today. I wish you good luck in your journey. This is going to be a long journey for all of us. I would like to reiterate my thanks to IFBMA for sponsoring this webinar, and my thanks to the WHO, because you guys are doing such an incredible job and you have been such fantastic partners. And it's only together, guys, that we are going to resolve this big jigsaw puzzle, but we will. So thank you, a big, big hug. Thank you for all of you that are telling me there is Brunei, there is Malaysia, there is so many more countries online. So thank you so much. There were hundreds of you. It's a joy to see there is so much interest in global policy. Thank you.